Hi, my name is Malcolm Wright. I oversee product management at Equicare Health. We've developed a software solution for cancer care coordination called Equicare CS. During this webinar, I'll provide a brief overview of Equicare, describing the basic features of the system as well as how we integrate with external software systems. We've recorded a series of webinars that demonstrate the various modules in Equicare, so if you want more info after watching this webinar, feel free to view them on this same website. Equicare is a software tool that allows cancer centers to coordinate care for patients throughout the cancer care continuum, from screening through to diagnosis, through to survivorship. We focus on supporting three programs: navigation, distress screening, and survivorship. Our navigation module makes it easy for you to manage and report on barriers to care, manage and report on referrals for medical services, support services, and provide targeted education to patients about their tests, procedures, treatment options. Our distress management module allows you to incorporate distress screening directly into the standard of care. It can be delivered using the distress thermometer or distress causes assessment or something else that you want to use. The information captured by patients, or it can be captured by nurses using the assessment tools. Our survivorship module allows you to create individualized survivorship care plans for patients based on the Institute of Medicine's recommendations. So these include components like the treatment summary, a follow-up plan, or targeted education about late effects and monitoring. Equicare is a web-based application, and it includes three portals for three different stakeholder groups involved in patient care. There's a clinician portal targeted at nurses, physicians, social workers working within the cancer center or hospital. There's also a patient portal targeted at patients and their family members to securely access their records from home and interact with the cancer center. Finally, there's a PCP portal that allows primary care physicians to access the records for those patients that they've referred over for care. When I describe Equicare as a web-based solution, some people assume it's hosted in the cloud and cannot be modified. In fact, Equicare is highly configurable, so your branding, your staff, your patient education materials can all be built directly into the website. So when we look at how we consolidate patient data, we need to start with your oncology information system, like ARIA or Mosaic. These systems do a great job serving the needs of clinicians working directly on patient treatment, but they don't really address the needs of other stakeholders like the patients, the navigators, or the primary care physicians. That's really where Equicare comes in by extending the OIS so it can meet the needs of the entire patient care team. We can do this because we have rich interfaces with those systems, whether you're in a radiation oncology environment, medical oncology, or combined. We automatically build and maintain a consolidated patient record by pulling together patient data from one system or from multiple systems if you've got more than one. And this isn't just a one-time feed, but it's kept up on an ongoing basis as the patient progresses through treatment. So you can see on the right, we've got a number of functional areas where we can exchange data. This includes things like demographics, appointments coming out of your scheduling system, and the patient's diagnosis. It also includes more complex types of data like the chemotherapy, the hormone therapy, or the radiation treatment details. And this is really important because this is what allows Equicare to automate the creation of the patient's treatment summary. If you have nursing staff trying to do this manually, it's a process that can take 2 or even 4 hours per care plan. So there's a significant savings having these sorts of interfaces in place. We also can extract data about the patient's family history. We can pull lab results, medical notes, and of course the CCD document that's so important for meaningful use. With ARIA, there's some recent changes that also allow us to integrate workflows so that ARIA users can access Equicare screens directly from the ARIA menu system. Also, so that patient documents that are created in Equicare, like the survivorship care plan, can be pushed back into ARIA and made part of the patient's record there. Equicare is a flexible software platform. It allows you to define your navigation and your survivorship programs using standardized templates. So Equicare ships with a comprehensive set of oncology-specific templates, and these are sourced from reputable organizations. We've got licensing agreements, for example, with NCCN to use their follow-up guidelines. with Facet to use their functional assessments, and with Inticare to use their symptom assessment tools. We have coverage for all the major disease sites. You can see them there at the top, breast all the way through to testicular, and we're adding new ones with each release. So in our next release, for example, we're looking at adding bladder and thyroid cancer care. Some of the benefits of this templated approach means it makes it easier for you to build a survivorship program quickly, and it ensures that the best practices are embedded directly in your program. Having said that, this template-driven approach also gives you flexibility because you can customize or extend your program. So for example, if you want to include your own pamphlets or your own support materials in the education library, you can do that. If you want to take a paper-based survey that you're currently providing for patients and implement that using Equicare, you can also do that. So the whole delivery, collection, and reporting of patient-reported outcomes is incorporated right into the tool. Let's talk about some of the benefits to cancer centers of having a survivorship program in place and of Equicare specifically. Probably the single most important benefit is related to improving patient care. One of the fundamental premises of survivorship is that patients that are engaged in structured follow-up should receive better monitoring, which allows them to detect recurrences earlier, and should have an improved ability to identify or address treatment-related late effects earlier. Equicare offers tools that support a structured follow-up, as well as tools to educate patients and smooth the transition back to community care. Another benefit is improved patient satisfaction by providing high-quality, up-to-date, and targeted information to patients about their diagnosis and treatment and follow-up. It ensures that patients remain well-informed and have a really positive impression of your organization. Additionally, we can reduce administrative costs by shifting some of the high overhead tasks to the patient portal. For example, sending lab results out to patients or having staff calling them up to remind them about upcoming appointments. In addition, we can shift a percentage of follow-up activities away from the oncologist to some of the lower-cost nursing staff within your facility. This makes your oncologists more available for high reimbursement activities related to treatment. Another important benefit relates to meaningful use. Equicare is the most practical way for customers to meet their meaningful use objectives related to patient engagement. For stage 1, these objectives relate to providing patients timely access to their health information, providing them with patient-specific education or preventative care reminders. For stage 2, these patient engagement objectives are significantly ramped up. So for example, to require secure messaging between patient and physician. Cancer centers will be able to rely on Equicare Patient Portal to meet these objectives and to make compliance reporting easy. Another big benefit relates to the American College of Surgeons accreditation requirements. You may be aware that the Commission on Cancer has added 3 new requirements for the 2015 accreditation period that cancer centers have to implement: a patient navigation program, a psychosocial distress screening program, and a survivorship program. Equicare supports all 3 of these requirements today and has been recognized by the College of Surgeons as a best practice for all 3 programs. And we're the only vendor to be recognized for this. So thanks for your time today. If you want more information, please visit our website, it's listed there, or send us an email. Also, feel free to watch the other webinars on this series, also available from this website.